Hello there, I'm Dr. Hazel Oon, Senior Consultant with a special interest in psoriasis. Today, let's discover more about psoriasis and how it affects people. What is psoriasis? Psoriasis is an inflammatory skin disease characterized by an increased rate of skin cell turnover, resulting in thick scales appearing on the skin. The affected skin becomes dry and unsightly. Itching is often experienced in a hot and humid climate. As part of our skin, nails also show changes like pitting of their surface in up to 50% of people with psoriasis. Joint pain and swelling are seen in up to 40% of those with more extensive psoriasis. Psoriasis usually presents with red, scaly patches on the scalp, body, and limbs. The scaly patches on the scalp are usually thicker and more extensive than ordinary dandruff. Common body sites affected include the elbows, knees, and back. Psoriasis usually starts in the 20s but has been described at birth and in old age. Like diabetes and other chronic diseases, psoriasis has a delayed onset and seldom remits permanently. However, unlike other chronic illnesses, it rarely shortens life expectancy. Studies show that patients with psoriasis have a genetic predisposition to develop disease, which is triggered off by environmental factors such as infection or certain medications. As a result, there is an imbalance in the immune system, which leads to the appearance of psoriasis. Physical and emotional stress are well known to aggravate psoriasis. Throat infections or flu may also aggravate the disease as well. Some drugs, like steroids and certain antihypertensives, may provoke the appearance of psoriasis. Topical creams, ointments, and scalp solutions. Most people with psoriasis have mild disease and get considerable relief with topical applications. These include topical steroids, coal tar, and non-steroidal vitamin D derivatives. For the face, hairline, and groin areas, mild steroid or calcipotriol creams can be used. Phototherapy. Psoriasis responds to ultraviolet light treatment. Narrowband UVB has been found to be effective in clearing psoriasis if used in gradually increasing doses over a period of several months. Oral drugs. Your dermatologist may prescribe oral medications when psoriasis does not respond to topicals and phototherapy. Examples of such drugs include methotrexate, cyclosporin, and acitretin. Biologics. These are drugs which help to control extensive disease when other treatments have failed. Biologics have to be administered via injection, subcutaneously, or intravenously. They work by balancing the immune system in the skin. Do use treatments regularly as directed. Do keep the skin well moisturized, as this will help to reduce itching and scaling. Do have healthy lifestyle habits, eat in moderation, exercise regularly, and manage your stress levels. Do regular health screening, as obesity, diabetes, hypertension, and cholesterol problems are more common in psoriasis. Do remember that the sun may help psoriasis, but be careful not to get sunburned. Do monitor for any joint pain or swelling, as a proportion of patients also have psoriasis involving the joints or psoriatic arthritis. Don't scratch the plaques, as this may damage the skin and actually worsen psoriasis. Don't give up treatments too soon, as it may take a few weeks for some of them to work. Don't allow yourself to have too many thoughts of self-pity or sadness, or distance yourself from loved ones. Learning to accept it as part and parcel of life is important. Is psoriasis contagious? No, psoriasis is not contagious. Will I pass psoriasis to my children? Not necessarily so. Psoriasis is a hereditary disorder, but only about 10% of people with psoriasis have an affected family member with psoriasis. The cause of psoriasis is multifactorial, and inherited genes do not always express disease without the appropriate environmental triggers. Is psoriasis a rare skin disease? No, psoriasis is not an uncommon skin disease. It is estimated that 1 to 2% of the population have psoriasis. Are there any foods to avoid or supplements to take to help my psoriasis? No, but it is wise to consume a nutritious, well-balanced diet containing more green vegetables and less meats. Excessive alcohol consumption is best avoided because of its association with poor nutrition and also liver disease. Is there a quick cure for psoriasis? No, but your doctor should be able to help you control your psoriasis. Oral or injected steroids are best avoided because although they may help to clear the psoriasis fast, this may result in a quick and severe rebound of psoriasis. Remember, psoriasis can be controlled with the appropriate and correct treatment. How is psoriasis related to metabolic disorders? In psoriasis, there's chronic inflammation of the skin and an imbalance of the skin's immune system. This can also contribute to heart disease, development of hypertension, and diabetes. If you feel that this may be related to you, 1. Consult your doctor for advice on screening for metabolic disorders. 2. Stop smoking. Smoking cessation counseling is available in NSC. Please ask your doctor or pharmacist for more information. Number 3. Avoid excessive alcohol intake. Number 4. Maintain a healthy weight, diet, and exercise regularly. And 5. Ensure your metabolic disorders are well controlled. Thank you for watching. If you have any further questions about psoriasis, do not hesitate to reach out to our doctors at the National Skin Center.